And welcome to another episode of Homefront. And today, by public demand, we have Prof. Michelle Montai, our immunologist, with us alongside JP. Guys, so thank you very much for being a part of this, right? Because on the last episode that we had Prof with us, we were debunking some myths, right? Mm-hmm. And today we are back at it again because we have so many myths that we want to debunk. And JP, I just remembered one that I heard on my way here, is that a gentleman, he told me that he heard that people who took the vaccine, the soldier wasn't standing at attention anymore. So, we want to find out, I am speaking on behalf of the men of Trinidad and Tobago, does taking the vaccine affect our soldiers? Does it affect our sexual performance?
Well, no, you'll have to go and find Nicki Minaj, because but the reality is that getting COVID-19 probably does affect your soldiers, and there's no doubt that COVID-19 virus has been found in testes, and how that might affect your fertility is something that we still don't know.
So is it a higher risk factor in terms of sexual performance, that is, with the vaccine or with COVID?
Well, I don't know that there's any proof that your vaccine is causing any sort of impotence, right? What I am saying is that we do know that you can find the virus within your testes and how that might cause inflammation there and therefore affect your production of sperm, which could lead to infertility. Doesn't necessarily mean that your soldier could not stand up, but you might be shooting blanks.
Okay. So she cleared this one up.
So vaccine, soldier, good. COVID-19, soldier, bad.
He said shooting blanks. Maybe shooting blanks. I love that.
So what, we have the next myth?
Right, so the other one was that there are certain drugs out there on the market that are able to cure COVID-19, JP?
Yeah. So Prof, we of course we know ivermectin. That's a very controversial. Any thoughts about that?
Well, again, I'm an immunologist, and the only thing I know that actually educates your immune system and therefore provides you with knowledge before you actually get the infection or to prevent you getting severe infection is in fact immunization. All these other medications such as ivermectin, budesonide, fluvoxamine, other things which are being investigated and continue to be investigated. Ivermectin is one that seems to have captured the public interest. What I can say is that its effects have been very varied across the world. I mean, people have spoken about how good it is in India. I don't know, but I've heard that India has actually immunized 1 billion people. So whether it's working or not, they've still gone for the vaccine. In South America, where ivermectin in Brazil was very easily available, the Brazilians are rushing to be vaccinated because whole towns were on ivermectin and it didn't really make much of a difference. So I think that there is a lot of variation in the data that is coming from different parts of the world. I think it's still being researched. I think that there's some high-powered studies that are going on in the UK, and one was just completed in Brazil. The one in Brazil wasn't so supportive. We'll see what the UK one does, So I think we just have to watch that space. But there are other drugs that are being used, budesonide, fluvoxamine, this new antidepressant, which has been around for a while, that is now being touted. There are new antivirals that are coming in. So I think that that's a space we have to watch. But they are not a substitute for immunization. And I want to make that point. The only thing that educates your immune system is, in fact, vaccination. I just want to just quickly say as well that some drugs, if you take them, can in fact affect your immune response. And this is something, even some of what you used on there's some data now suggesting that even some of the drugs that are being used in severe patients may get them past the bad episode, but that their immune response further down the line is not robust enough. And that could be true of ivermectin and some of these other drugs that are being used to cure COVID.
So you would think the reason that Rome got vaccinated was to go back and sing parang, to have a great Trini Christmas, to be on the road carnival Monday and Tuesday having a fun time. But the reason why I got vaccinated was for my family. I have a bigger sister who has lupus, and her immune system is weaker than the average person. So myself and my entire family, we went out there and got vaccinated to protect her. She herself did it with the advice from her doctors. So let's do our part and vaccinate TNT.
right
Okay.
now, all we're saying is that we're not sure,
Yeah.
but the best thing, once you're not sure, because people talk about getting the data, right? So
Yeah.
the data is you're not sure. Well, what we're sure about is that vaccination can make your immune system stronger to fight COVID-19.
But that's what I'm now coming at, because some people say that if you get the vaccine, that will actually weaken your immune system later down the line.
Well, I don't know where they got that from, but if they could send me the data, I'll look at it, you know. As regards vaccination, obviously I'm very pro-vaccination. I even got my flu shot yesterday.
Right.
And guys, I just want to say that I have got my flu shot every year for the last 15 years, and maybe that's why I look so young for my age.
I love it, I love it, I love it, I
How old are
love
you
it.
again, Prof?
I love
25?
it.
25?
Do I have to say?
She just said 21.
Yeah,
She just
she
said 21. But you can see the effect. You have been, I mean, not only is she an immunologist, but she has been taking her vaccines for years. Not the
that's right.
COVID-19 vaccine, but
Yeah,
vaccines
that's right,
on
that's
a whole.
right. And I expect to be here in 18 months' time. I'm about 6 months past my COVID. I'm sorry, I'm not writing any will. Maybe if driving on Trinidad roads, I should be writing a will, but not from vaccination. Sorry,
But
guys.
you mentioned something in the last episode that we had here about using the vaccine was educating the immune system
Yeah.
and educating the body. And that brought me to thinking, I'm hearing talk of booster shots coming.
Sure.
But I'm thinking, well, okay,
Yeah.
why do we need a booster
Sure,
shot? If we
sure.
took the vaccine and the immune system has learned
Yeah,
about the
sure.
virus, then why a booster shot? Does the immune system forget about the virus?
Well, the way to think about it is like this. Even if you get COVID-19 infection, you can't get it again.
Right.
So it means, therefore, that the immunity is not as robust as, let's say, to measles, which is not a changing virus.
Sure.
Okay?
Right, yeah, of
All right?
course.
So that once you can have change, what you find is that the immune system in some people might not be as good as you would hope. Okay? And so the reason for boosting is really to cover the variants that we have seen. All the vaccines have been based on the Wuhan, the original. Okay, we now have Delta. All right, so and there's overlap, but Delta is there is difference. All right, and so the immunity that you have would be great against Wuhan, but in some people has not proven to be brilliant against Delta. Okay, so that's why, particularly in people who have other diseases that can compromise the original immune response, that's where we probably want to boost. We want to boost the elderly. We want to boost those
special
who have,
categories, right?
yes, those who have certain. We feel that younger people, even if they might not need boosting in a hurry, all right, that they probably have made robust immune responses, that their immune responses may be sufficient for them to cover the Delta also too, and so it's somewhat controversial also too. Antibodies are not the only way we protect against a virus. We have T cells, we have memory B cells, etc. So the thinking right now is that boosting probably should be given to people who perhaps have a little bit more susceptibility.
Right,
to-
frontline
to-
workers also, right?
Frontline workers are also
So the higher risk
the higher
groups.
risk groups,
Right.
And I think the jury is out, at least in scientific circles, as to whether we really need to boost the younger younger people who are quite healthy.
And
you
talking
know?
about higher risk groups, there's a group of obesity.
Yeah.
And I heard people mention comorbidities,
Yeah.
but
Yeah.
does obesity fall into that category? Does it put you at higher risk?
Absolutely. Obesity is way up there with diabetes, and is probably
It's probably higher.
higher.
When you
So
believe that, we talk
that's
about
right.
we talk about
Yeah.
diabetes, hypertension. I think we need to talk more about obesity.
Absolutely.
To me, that's what I've seen, Prof, in terms of the ICU, is that risk factor by itself has the highest risk of death, even more
Yes.
than diabetes and hypertension.
Yes.
Yeah.
Yes.
Yeah.
Yeah, and what people don't realize is that obesity is what we call a pro-inflammatory state.
Yeah.
You already have this heightened immunity, inflammation going on. And all you do now is add that virus in, and the inflammation becomes hyperinflammation. And really, a lot of the serious COVID and death is because of uncontrolled inflammation.
Sure, yeah.
So another myth that we got was that if I'm vaccinated, you kind of have superpowers, that you don't need to wear
Yes,
your mask.
Superman, man. Say it like it is, Rome.
You don't need to wear your mask anymore because you're vaccinated. So a lot of vaccinated people are walking around there thinking as though they do away with this mask, we should
Sure.
open back up and we don't need to wear this. What are your takes on that?
Okay, I think the way to think about vaccination is like you've built a wall, okay? And it's much harder now for the virus to jump over that wall and infect you. But if you are in a situation in which you have a lot of unvaccinated or people and there are high levels of virus around there in your environment, some will jump that wall.
Right.
And you could get a breakthrough infection, you see? So what they are recommended, at least abroad, is that in circumstances where you're more likely to be exposed to a lot of virus is the place to put on your mask.
Right.
Maybe not walking around the savannah, I pull up mine, I pull it down, you know, but you're inside in an indoors environment, lots of people, you don't know how many of them vaccinated or not, a lot of virus in the air, you put on your mask. You be careful. You be
Because
careful.
why I said that is that people are saying, okay, if they're pushing this vaccine and asking people to get vaccinated, does it mean that forever we are going to have to wear masks?
I'll tell you what is probably going to happen, as we see with influenza. What is going to happen is that we are probably people who are, we can get infections more than once. If influenza, you can get the exact same influenza more than once. So far, you can get COVID, usually the variant next time, all right? But the point is that each time your immune system sees it, or the amount of severity of infection is less, and usually after about 3 or 4 episodes, you might be getting it, but you won't have clinical manifestations. You see what I'm getting at? So that the same thing about the vaccine. So we are probably going to need our 2 vaccines and maybe 1 or 2 boosters. And assuming we don't get a lot of really significantly different variants, you're going to find that we're probably all going to be okay.
Okay.
Right.
By 2022. So by
Well,
December 2022, so yeah.
Probably 2023.
Maybe 23, yeah. I just want people to know that WHO is saying
yeah.
until at least December 2022.
Yeah.
At least, Rome, at least.
All in when we have a carnival at all.
I know. Well, that's strong too. So let's try it.
But before we go to there, we want to jump inside our mindfulness moment because we still have a lot more questions coming from our vaccine hesitant group in terms of myths as well. So let's take a deep breath as we head into our mindfulness moment.
Today I want to tell you about a technique called the body scan. It's really important for us to check in with our bodies, as we often ignore signals from our bodies telling us how we feel in the minute or the moment. So a technique is an easy one, but let's practice it together. So I want to invite you to get into your mindful bodies, eyes closed if you're comfortable with it, or look down at a point on the floor. And just take a deep breath in and out to settle. We're first of all going to take our attention to our feet and our toes. See if you can feel them. Moving up gradually from our ankles to our knees, to our thighs, your seating bones wherever you're sitting, your lower back, your abdomen, your chest, and shoulders. Just see if there's any areas that are tense and see if you can breathe into them and let them go. Up to your neck, your face, and in between your eyes, between the eyebrows often is a place of stress, and all the way up to the top of your head. Excellent job. Checking in with our bodies can often give us a really important signal as to areas that we carry stress and tension. If you notice any, just try and see if you can take note of it and just relax and let it go. And remember to practice being here now.
It's Rome, and we are here. We're chilling with the boys. We're living with the kids. We're doing this all for the PED Cares Foundation. So we need you at home watching us to go donate. Head over to the pedcares.org and send that donation, whether it's via credit card, direct transfer, because we want to make sure that the kids of our pediatric emergency department get the best possible care that they can get, because we need to take care of the next generation. The future lies with the kids. You all ready? On three, we go and say yeah. 1, 2, 3. Yay! the PED Cares Foundation. I always love our mindfulness moments. It just relaxes us. If you're having a tough day, you breathe in that positivity and breathe out all that negative energy. And we are back. I know that JP had a burning question for Prof.
I find Prof has a crystal ball, right? So I want to know, right? So, Prof, in terms of November, we know schools are coming out, right? What do you propose will happen in terms of that mixing? I mean, obviously, what do you think is going to happen with our surge?
Well, I think that we will continue to see increased numbers. Why do I say this? I think that what will happen is young people are young people. They're going to school. For the first week or two, they will socially distance. They begin to feel, well, we're good, nobody are infected, and they will begin to mix more. Yeah. We have kids who are unvaccinated. We have some who are vaccinated. And what we're going to find is that there's going to be a spread of the virus. Right. Now, they might continue, many of them asymptomatic or very mild infections, but they will be taking it into their homes. Sure. And the problem is in Trinidad is only about 45% of our population is fully vaccinated. Sure. So it means that we have a lot of susceptible adults, older people, people with comorbidities. We've just spoken about, we spoke about obesity, etc. And as a result, we're going to find a lot more of the spread within homes and therefore increased numbers. So I'm anticipating that we're going to see a big increase in cases and also, unfortunately, hospitalizations and possibly deaths.
In November, December?
In November, before Christmas. And I can only hope that this will encourage people who are not vaccinated to go out there and get vaccinated. So
probably could just look in our crystal ball and see what carnival looking like.
Well, it depends on what November, December look like.
So
my crystal ball don't go past 2021.
Because as I'm thinking, because I mean, I have experience traveling. I've traveled. I saw New York where they had only vaccinated people going to the clubs. I've been to nightclubs where they had hundreds of people in the nightclubs who were vaccinated. And then I saw on the flip side, I went to Miami and their governor took a totally different approach where he had everybody. You just go out, it's like it's a free fall in Miami. And I saw how they had their carnival as well, where you had to provide your negative PCR test. So it had me thinking, is it possible for us to have a carnival come 2022?
That's a hard question.
It's a hard question. And also a lot depends on the health services and the health systems and what is going on. I mean, right now we are hearing that we have very few ICU beds. You have said that more people are coming in sicker and are actually going into ICU. And it's not so much the ordinary wards, and all unvaxxed, all right? And so it really is down to the population. Do you want your carnival?
You're right.
You know, if you want your carnival, it's a time that you might get extra money that you are able to enjoy, and just after all of this lockdown that we have had and change in our circumstance, your best way of doing this is to get vaccinated.
So you think that if more of the population gets vaccinated, it will increase the likelihood of us having a safer carnival?
I'll speak to the Prime Minister on that.
All right, good. Thank you.
Prof, if people get vaccinated, I can actually go and whine,
if you want.
So let me be serious though before the episode starts. So a hard question to you, Prof. If you were to ask, if you were talking to the health team that makes decisions, what would you advise us in terms of a group? How can we increase the uptake of vaccines in Trinidad right now with those who are still vaccine hesitant?
Well, I think that what I am kind of not understanding is why some people are choosing to listen to misinformation versus groups that actually are really well educated and you hear, well, that's big pharma. WHO isn't so much big pharma, and the people who work on their SAGE, their advisory group, okay, maybe you mightn't agree with everything, but you know what? They have been doing their subjects for years and years and years. So they have experience, they're thinking about it, understanding it. Rather than going on the YouTube and seeing someone who did A-levels in science and is now speaking about virology, and you have just completely dismissed all the virologists who have been working on this for 30 odd years, every day of their lives. How could you make that decision? So some of the choices are really, I don't understand. So I would say it's important that you educate yourself properly. I think as healthcare workers, we really have a right to do it, to be mindful of the fact that we are supposed to know more. We're supposed to understand science more. And yes, some people say, well, this is a new vaccine. I don't know what is going to happen. And I would say to them, look, this is a war. And the people who win wars are the people who resist. And frankly, what are you waiting for? People like me? I'm not your guinea pig. I know I'm going to be alive in 2 years' time. You know, I that's not going to happen. If I die, it's because somebody knocked me down. It won't be for any other reason but driving on Trinidad roads. But so the point is that we are duty bound as healthcare professionals to go and listen to the true experts. You need to do that, and you need to go with an open mind. You need to go with an open mind.
All right.
Yeah.
So with this, we could see that based on what Prof was saying, we debunked a lot of the different types of myths that we have had as the vaccine hesitancy, and we're hoping that people got a lot more information. As we said, we were going to bring the information back to you guys, so we are hoping that you receive it with open arms, because what I always ask people to is to have an open mind, is that you don't know what you don't know. So as much as you be getting information from all over, we want to make sure that we provide the right information for you right here on Homefront. And we also want to encourage you to head over to pedcares.org and donate so we can help the kids of our future. My name is Rome. We have Prof Montai with us, JP. Thank you all very much for joining us for another episode of Homefront.